Wake Up Your Health is brought to you by Lynx Healthcare. Your health is our mission.
It is 6:15. You're watching Wake Up Northwest, and in this morning's Wake Up Your Health, we are joined by Dr. Guy Jones. He is a radiation oncologist from the Tri-Cities Cancer Center. Good morning. How are you?
I'm doing great. Thank you, Morgan.
Yeah, and we're revisiting skin cancer today because, you know, we're getting towards the end of the summer, but it is, in fact, the hottest month of the year. Is that correct?
Yes, that's right.
And so what do people need to know about the risks of skin cancer?
Yeah, so, you know, some of the risk factors for developing skin cancer, unfortunately, fair-skinned individuals like myself, we have a harder time. People that live in higher altitudes or tropical climates, there's some genetic predispositions as well, and then people that are immunosuppressed, so people with AIDS or have a transplant recipient or something like that can all predispose you to getting skin cancer. So there's a lot of risk factors out there.
And, you know, skin cancer is really common, unfortunately, when it comes to cancers. Why do you think that is? Do we just ignore our bodies? Are we looking for signs? I mean, what's going on?
Well, for years there really wasn't a lot of ways to protect your sun or your skin from sun damage. So you know, sunscreen is wasn't always widely available, and now it is. So that was a big part of it.
So this stuff would be a good example of what to have probably.
Exactly.
If you're going to be outside,
yeah,
right?
you know, the very best thing you can do is kind of, stay out of direct sunlight. So if you can stay indoors or, under awnings or under umbrellas, something like that, that's the very best thing you can do. But of course, we all like to be out in the sun, and there's, of course, health benefits to that as well. So in those cases, you want to just have some kind of a protective layer between you and the sun. So wear a shirt, wear a hat, sunglasses, and then sunscreen. We usually recommend an SPF of 30 or higher. Beyond that is kind of diminishing returns, but 30 or higher should protect you pretty well. And
do it pretty thoroughly too, I'm assuming.
Exactly.
And the other thing, let's talk about the smoke, because a lot of us don't want to be outside right now, but if you are, it's kind of like that false sense of the UV rays are still coming through, right?
Yeah, that's exactly right. So, you may get a false sense of security because it's not as bright and sunny, but the smoke isn't necessarily protecting you from the UV rays. And so those same precautions still apply right now as they always did.
So what if you do find something suspicious? Number one, what should you be looking for, and then what should you do?
Yeah, so the big thing is just, really be cognizant of your own body. If you see anything changing, anything that you just really think should not be there, then get yourself to your primary care physician. That's a really good first start. Lynx Healthcare has a great primary care focus as well, and then there's the local hospital systems, Tri-Cities Community Health. Some of these will have primary care providers that can take a look, and if need be, can do a biopsy, sort of look at it under a microscope and determine whether or not this is a cancer. It's a common condition we deal with, the most common type of cancer known to man, and so it's a common thing we deal with. And if you do get diagnosed with a skin cancer, there's a lot of things we can do. So get yourself to an oncologist, either the Tri-Cities Cancer Center or somewhere else to give you all your options.
All right. Thank you, Dr. Jones. We appreciate it. 6:18, you're watching Wake Up Northwest. Your full weather forecast in 2 minutes.